We're going to start off right now with President and CEO of Valley Children's Healthcare, Todd Suntrapak. Todd, good morning to you today.
Good morning, Zara, and good morning to everybody on the Zoom press briefing. As Zara said, the new normal. I want to first take a moment to especially recognize the healthcare workers across the state of California that are fighting this fight against this virus every day in every community in our state. Many of them unrecognized for extraordinary efforts. And with that, we'll now shift more into a discussion about kids and Valley Children's role as a unique one in the central part of our state. Valley Children's is the only specialty provider between Los Angeles and San Francisco. I think it's safe to say, I hope we would all agree, that there have been few times in our history where the health of kids and the health of our communities has been as challenged as we are now experiencing COVID-19. With that said, we would like to make sure through this briefing that we have a chance to share information that we have at Valley Children's, our decision-making processes informed by science and some of the finest medical minds in the country as we care for kids every day, and in particular as we take certain policy positions that frankly we believe could use more coverage, more discussion, and certainly more specificity to inform the thinking of parents and the communities and support the thinking of parents and communities, both in the Valley and possibly on a broader campus. We will continue to hold these briefings in the future from time to time as the inflection point is appropriate and as various developments within pediatric medicine and policy affecting children come into question, and or there needs to be a refinement of our thinking. So I'm going to begin with a brief overview of the COVID-19 trends we're seeing across the state and here in our Valley. Then I'll turn it over to our Chief Physician Executive and Chief Medical Officer, Dr. David Christensen, and one of our leading, in fact, the leading infectious disease physician at Valley Children's, Dr. Niall Mason, to discuss the specifics of COVID-19 and kids. And so as we look at the state through Tuesday, there have been more than 400,000 cases, 413,576 cases. On Tuesday, there were 12,807 new cases in that single day, which was a 3.2% growth in those cases. 7,870 Californians have died as a result of COVID-19 since the beginning of the pandemic. 115 new deaths were recorded related to COVID-19 on Tuesday, which was a 1.5% increase. That may sound like a manageable number to many. It certainly doesn't to us, and I would hope it wouldn't be an acceptable number to anyone. Having said that, hospitals are in unique positions, including the state's children's hospitals and the country's children's hospitals. But in the state of California, we have over 70,000 licensed beds. A licensed bed is different from a staffed bed, meaning an organization can license a certain number of beds, but they need to have staff and appropriately trained staff in order to put a patient in that bed and create a staffed bed. In California, we have 50,000 staffed beds approximately at this time. And at this time, there are approximately 45,000 patients in those staffed beds. This is really, really important because you can then extrapolate that our surge capacity in the state is somewhat compressed when we consider that there are 7,170 COVID inpatients, COVID positive inpatients in those staffed beds. You start to understand, hopefully, the magnitude of the challenge, because while we are treating those patients that in some cases can be very trying, staff are required and need, in order to be safe, certain levels of protection through PPE. And donning and doffing PPE in and of itself is an activity. Providing clinical functions and care in PPE, which is hot, may not have the same tactile function that various clinicians are used to in treating patients, is a challenge. Of those 7,170 inpatients in the state of California, 2,058 of them are ICU patients. So obviously, our state hospital infrastructure is under strain. When we look at, turning to children specifically now, when we look at the case rates in the state of California, and there have been numerous, both reported in the media as well as reports in the communities that we serve by both public and private leaders, that children by and large don't get this virus, or they don't get really sick, or they don't transmit the virus. We know based on our data, and there is a slide that should be in front of you now that shows the weekly case count by county in the central part of the state. We know that in California, 8.7% of those 413,576 cases were children aged 0 to 17. Our experience at Valley Children's, which Dr. Christensen and Mason will speak to, is certainly consistent with that finding. And I might add that the numbers behind the case growth data on this regional slide in the central part of the state, it's, and I'm rounding here by a couple tenths of a point, about 12% of the cases are kids 0 to 17. So in our valley, there's actually a little bit higher incidence of COVID-19 in kids. Certainly, those data, which we are confident about, do not support a statement that children do not get COVID-19. Additionally, kids are, by many, some said not to become severely ill or be at risk of death by COVID-19. This is factually inconsistent with the experience at Valley Children's. Doctors Christensen and Mason will walk you through that in finer detail and be available for questions, as Zara said, a little bit later. But I want to spend just a minute before I turn it over to Dr. Christensen to explain that much of the narrative that is taking place, both in our valley, in our state, and nationally, related to children and the risk to children of COVID-19, foundationally, we object to. Because if you think for a moment that there are some conditions that children are afflicted with, that in a vast population only affect, say, out of 1.5 million kids, there may only be 150 times a year that we encounter new cases of that condition. So out of 1.5 million, 150 cases a year. And this is an actual number of an actual condition. We have doctors that have spent their lifetimes training how to take care of those children. how to ensure that those children have a chance for a future and a bright one and the one that they deserved. We have vast resources assigned to caring for those kids and supporting those families, both here in our valley and at children's hospitals and other hospitals across this great country. And so why is it that this narrative related to children being at risk for COVID-19 is frequently reduced to a decimal point and a couple of spaces to the right of a decimal point? This is a disservice to our communities and to children. There's no difference between a child that is born with a congenital condition, one of 2 or 300, having incredible amounts of caring, exceptionally trained care teams dedicated to them and fighting for their future, and what is viewed as a relatively small number of children that are greatly at risk. There is no difference, zero. We are as committed to making sure that children with COVID-19 are taken just as seriously with all of the resources we can bring to bear when they do become seriously ill, to guarantee that they have a chance at a bright and long, productive future. And so when we see a dialogue and a narrative that is focused on how small the risk is numerically to children, it is particularly objectionable, and we feel would be a miscarriage of our obligation to the counties, communities, families, and children that we serve, not to object to children being put in situations where the virus can be transmitted and where they can become infected, transmit it to other members of the family, which is factually what can occur. And most importantly, that they are in a situation where they can themselves be exposed, become positive, and then in some cases, unfortunate cases, have the disease progress in a way that leads to some of the conditions that Doctors Christensen and Mason will describe. So Zara, with that, I will turn it over to Dr. Christensen.
All right, thank you. Everybody, up next now is Dr. David Christensen. He's Valley Children's Senior Vice President of Medical Affairs, as well as our Chief Physician Executive. Dr. C.
Okay, well, thanks, Zara. I appreciate it, and I appreciate everyone attending today. This is a subject, as you can see, we have a lot of passion about. I would like to spend a little bit of time talking about the myths that Todd had gotten into a bit, and try to give some more detail around why we believe those myths are completely false. The first one is that COVID-19 does not affect children, and we can look at data throughout the country, and we can see kids being admitted in pretty much all the states for COVID-19. It's true that the majority of kids do really well when they get this infection in general, and in fact can be asymptomatic, and that's part of the reason why we don't really know the true prevalence of the illness in kids, because we just don't test a lot of kids with it because they're asymptomatic. There might not be a reason to test them at that point. We see the kids when they come through our door here, usually through the emergency room to be seen with symptoms. And we know the symptoms of COVID-19 are very similar in kids as they are in adults. And these would be things like fever, cough, difficulty breathing. The kids that really get impacted negatively by COVID-19 are the children who have other underlying conditions such as cystic fibrosis, congenital heart disease, conditions that puts them on the edge, that if this respiratory illness impacts them, it can send them over the edge. So we're real careful with those kids. But we do see a lot of kids get this infection. And if you look at the graph, it does show that we have tested almost 6,500 patients, kids who've come to usually to the emergency room here, or to our clinics, or in pre-op. And we have an 8% positivity rate, which, again, that 8%, most of the kids can be sent home, they're doing fine. And the bigger issue is, what do you do with the kids who have the symptoms? And what I'd like to do now is break those stats down into the kids who actually get hospitalized with COVID. We've had almost 70 patients this year, and a lot of them most recently, there's been a rev up in cases over the last month of kids with COVID. And some come in with, they might need their appendix out, and we test because they're going to pre-op, and we want to know if they're positive or not so we can protect our staff and the families from the COVID. And in those are cases that the child tested positive, but that was not what brought them into the hospital primarily. But for the kids who have been admitted because of COVID, we've had 17% of that 69 patients who are sick enough for pediatric ICU care. And those of you who have seen our intensive care unit know the severity of illness that we take care of there. So it is true that these kids can get very sick, especially if they have underlying conditions. The other condition that you need to be aware of it's something you probably heard of, is MIS-C, which stands for multi-system inflammatory syndrome in children. I think Dr. Mason's going to talk a bit more about that. But these are kids who've had COVID and then weeks to months later develop this really intense inflammatory syndrome that affects their lungs, their heart, their kidneys, and they become very sick. And we've had a share of those patients as well. Overall, 23% of our patients who tested positive for COVID came in for the main reason, either because they've had COVID symptoms or they've had MIS-C. So as you can see, the kids who develop and test positive for COVID can be very sick. We are using the antiviral remdesivir as appropriate, and that has shown early improvement in some of these kids. The age group, you may ask, well, we're seeing kids as young as 2 weeks of age, all the way into the late teens, and the average is about 9. And infants can get it, so there's another rumor out there that babies can't get it, and there have been studies showing it can actually be transferred both directions from mom to child. Myth number 2 is that kids can't spread COVID-19, and that just goes against logic, in my opinion. The spread of COVID is by coughing and sneezing particles out, and that's why we wear masks here. And one of the reasons I'm not wearing a mask here, because I'm in a room isolated by myself. But when I'm out any other place, I'm wearing a mask and goggles. Kids cough and they sneeze, and ensure that smaller kids may not have as much volume behind their cough or their sneeze, and so they don't maybe spread it as much. Plus, some kids are not symptomatic, so the numbers might be less. A couple of early studies came out, and I'm not trying to be negative about studies because studies help us make decisions, but a lot of the early studies that came out were really on very small sample sizes. And in statistics, we know, and in research, we know that you get more validity from a study if it's has a much bigger sample size. An example was one study done in the French Alps that really looked at one 9-year-old boy and how he did or did not spread the virus to people in his village and schools. A recent study just came out from South Korea, and that's in preprint right now in the Emerging Infectious Disease Journal. And what it showed was they examined almost 60,000 contacts and 5,700 kids with COVID to see if a child with COVID would spread that COVID to a family member. And what they found out was children 0 to 9, the younger kids, actually did not spread it that much. They were at a rate of 5.3%. So if you were in a household with a child that age with COVID, 5.3% of the people living there, the household contacts, developed COVID. But the numbers jumped up a lot when you looked at the slightly older kids, the kids aged 10 to 19. They spread COVID 18.6% of the time. So basically, if you have an age group 10 to 19 with COVID in your household or as a nearby contact, your risk of getting it, 18.6% of those contacts did get COVID in the study. So that kind of goes against some of the previous studies. And the reason I like this study so much is because it has such a large sample size. The rate of spread among the kids 10 to 19 was actually higher than the general average. If you look at the recommendations for school reopening, I think Valley Children's has been consistent with the recommendations that have been out there. The American Academy of Pediatrics stressed early on the importance of getting back to school, and we agree with that. We agree that children do best in school for a lot of different reasons, both psychologically and physically and mentally. It's the best thing for the kids. However, it needs to be done in a safe manner. And the American Academy updated their recommendation by saying that the decision must be guided by science and evaluating new evidence as it emerges. And I would say that new study in South Korea is definitely a powerful study showing a different story as far as kids spreading it. The CDC also originally came out with a recommendation based on the level of community transmission of the virus. And of course, we're in the middle of a very serious pandemic here. So we felt very strongly that this was not the right time to send kids back to school. We know it's important, we understand it, but with a large pandemic not showing any improvement right outside our door right now, we just felt it was the wrong time. Johns Hopkins School of Public Health also said in areas where transmission and infection rates are increasing, it may not be safe to reopen. I think CDPH and the California governor have made similar recommendations. So I just want to give you some background for why we feel strongly about that. And finally, what I want to talk about was our hospital focus. We are determined to keep our families and staff safe. And so we recently opened up a family care center here where we're providing care to our families who may not be able to get in other places. And we've tested 607 patients there and provided really important care for those families because we really understand the importance of keeping our staff healthy and without COVID so they can continue to do the great work they've been doing to keep kids healthy. So far, we've had no spread of COVID from a patient to the staff, and that's a tribute to the safety measures we've put in place and that the staff here are following. And I'll let Dr. Mason talk a little bit more about that. Zara, back to you.
All right, thank you very much, Dr. Christensen. Next up, we have Dr. Niall Mason. He is Valley Children's Medical Director of Pediatric Infectious Disease. Dr. Mason talking about the impact of COVID-19 and this pandemic on the kids we see here, as well as on our healthcare network. Dr. Mason.
Thank you, Zara, and good afternoon, everyone. So I would like to start by reiterating what both Mr. Sennerprack and Dr. Christensen pointed out about the number of cases of COVID-19 and how they're affecting the population that we serve here, children. So the number of cases of COVID-19 have been increasing across all age groups in our region, like they are in most of the regions in the state of California and also in many states in the country. So children are affected despite what some people believe, and pediatric cases have been rising. And this doesn't only speak to the cases of acute infection with the virus causing COVID-19, but also applies to cases that are complications of the infection. And one of them that many of you have heard about already is this syndrome that's called MIS-C, the multi-system inflammatory syndrome in children, which is thought to be an inflammatory response to the COVID-19 infection with manifestations that present weeks after the infection and could affect, like the name suggests, different systems or different organs in the body. And many times it could be serious enough to require admission to the intensive care unit or the hospital in general. So again, both of the acute infection cases and the inflammatory complication cases are increasing, and we have seen, like Dr. Christensen explained, we have seen increase in both of these conditions lately. The other thing I want to talk about is actually the response here at Valley Children's to this pandemic. So the health and safety and well-being of our patients, the families, and the staff have been our top priority since the beginning of this pandemic and always been. From day one, Valley Children's instituted different measures to mitigate the risk of transmissions, and I'm going to list a few of them. For example, early on, we started health screening at the door for everyone who is entering Valley Children's buildings. That includes children, parents, guardians, staff, doctors, and visitors. Everyone is actually checked for symptoms, and they get their temperature checked to make sure that they are not showing any signs or symptoms indicative of having COVID-19. And if someone does, then the appropriate measures are being taken to examine them and figure out whether they have the infection or not. The other thing that we also started early on is the universal masking policy, meaning every person entering the building should have a face covering on. And the decision about the type of the face covering is dependent on the risk of having the infection or transmitting the infection. So for our visitors and for our patients, it has been the cloth face covering. For any child over 2 years of age and older, obviously if they can tolerate wearing a mask. For our staff, now it is the medical grade mask with eye protection, the goggles or the face shield. And then for our staff who are conducting procedures that carry increased risk of airborne transmission, meaning transmission of the virus through these micro-sized particles, air particles, these healthcare personnel, they are actually required to wear the N95 respirator, which will provide even more protection for them. The other thing that we also took, some of the measures that we took to decrease the risk of transmission is the social distancing for the staff and for the visitors here. So that includes working areas and some changes that we made to make sure social distancing is appropriate and feasible. And that also included some changes we made to the cafeteria, the traffic there, and some of the public or common areas that we have in the hospital, and including waiting areas in clinics. The other thing that we've been working on and trying to maintain adequate supply for personal protective equipment, because we want to make sure that this is a safe environment for our staff and for families and for our patients as they're being cared for here in this hospital. So there have been tremendous effort from the hospital leadership to actually maintain adequate supply of personal protective equipment. The other thing that we would like to talk about is actually emphasizing that our efforts here are not isolated from the efforts in the community. We are trying our best, like always, to serve the community and care for the children that need us here. But also we would like to ask the assistance and the help from the community by help us working together to mitigate the transmission of COVID-19. And there are several measures that the community can actually take to help us in that effort. One of them is following the recommendations for the face covering, wearing a mask, a cloth mask or face covering as someone is leaving the house to try to limit their ability to actually transmit the infection or even acquire it. The other one that's also important is maintaining social distancing, staying away from large gathering, maintaining 6 feet distance from others, again, as you leave the house. Limiting exposure risk by avoiding large crowds, staying home as much as possible, particularly if someone is sick or showing symptoms that are consistent with COVID-19, that many of you are familiar with: the fever, cough, runny nose, tired, and in some instances, gastrointestinal symptoms, which means nausea, vomiting, or diarrhea. So these are the points that I wanted to mention, just in addition to what Todd and Dr. Christensen mentioned, but I'll be happy to answer any questions later on if you guys have any. Sarah, I will turn this back to you.
All right, thank you again, Dr. Mason, Dr. Christensen, Todd Sunterpack. We do have several questions people have submitted via chat. The first one comes from ABC 30. How will COVID-19 impact flu season among kids this year? Is that going to be an even bigger strain on Valley Children's and other hospitals? Opening it up to either you or Dr. C.
Well, maybe I can start with that. Pediatrics can be very seasonal, and the busy season for pediatrics is winter and spring, early spring. And at that point, we see things like the flu. We also see conditions, mostly infectious disease type conditions, such as RSV, bronchiolitis, and other gastroenteritis disease that cause kids to be pretty sick. Obviously, the concern is if COVID continues or worsens, and the resources get stretched to the limit, then you add on top of that another potentially bad season for the flu or bronchiolitis. The concern is whether the resources will be available. So our hope is that we stomp this COVID thing out before that time hits, and then we can focus again like we normally do on the flu and bronchiolitis. But right now we're in the middle of a pandemic, so yeah, it's a big worry we have. The important thing is we can stomp this thing out if we just follow the basic rules of wearing a mask and social distancing and things like that. We have control over that.
Dr. Christensen, another one for you. Would Valley Children's doctors, this is from Jim Jacobs at GV Wire, would Valley Children's doctors be nervous about allowing kids to go back to in-person learning before a vaccine is available?
I think it's less about the vaccine. Obviously, we really would love to see a vaccine, and we want to see a vaccine that works and is safe. So the sooner that's available, that would be a wonderful thing. But I think more importantly, what we want to see is the prevalence or this transmission of COVID-19 be brought down. It's like fighting a forest fire. You need to keep stomping it out or it flares up again. And that's part of the rules of sending kids back to school here in California. All the counties need to meet a certain criteria, and part of that criteria is not having increasing cases and showing improvement. And some states have done that, and in California we're struggling quite a bit. So I guess my first focus should be on let's stomp out the transmission of the virus as much as we can, get it down to a flatten the curve like they talk about. And then of course we'd like to see a great vaccine come into play, but we don't have a lot of control over that. People are working hard on that right now, but we do have control over is flattening the curve.
All right, Bakersfield, the CBS station in Bakersfield, Tara Majors asks for kids 17 and under. Dr. Mason, let's go to you for this one. Are there specific complications that affect them differently if they become infected with COVID-19? And are there specific side effects that parents should look out for?
So the main one that we're seeing specifically unique to this population is this multi-system inflammatory syndrome. So this appears to be more unique to children and not necessarily seen in older individuals or in adults. So that's one of the ones that we are all on the lookout for, actually, when we see cases with acute COVID-19 or patients recovering from COVID-19. And if I may just comment on the first two questions briefly. The prediction game with COVID-19 is always a losing game. It's very difficult to predict how things will look like, particularly when we talk about the respiratory season, which is for us is in December and January. That's when we see the peak of RSV and influenza. So between now and then, it's very difficult to tell how the pandemic COVID-19 will look like. What we are seeing right now, rather than just having waves with COVID-19, we're seeing hills and valleys where you have clusters of the pandemic transmission popping in different communities. So again, it's near impossible to predict how things will look like. As Dr. Christensen said, having a peak of COVID-19, RSV, and influenza will be extremely challenging and perhaps devastating to the resources of all healthcare systems. But also there are some other measures. So the measures that we're taking to limit the spread of COVID-19 will also help us limit the spread and the transmission of RSV and influenza. So I am optimistic. I am hoping that these measures will actually lead to us having a milder season this year of RSV and influenza. The second question about the schools, I hope that it will not be, so going back in person to classrooms will not be dependent on having an effective and vaccine that's already rolled out and already taken by the majority of the population. Because if we wait for that, then we're talking about months and months of delay. And once again, like Dr. Christensen said, being physically in school is extremely important for the students, for the children, not just for their learning, but also for psychological impact and for their mental health. And also many of the patients, especially the ones with complex medical conditions, they depend on services provided through school for their healthcare. So going back in person is important. There is no one size fits all. There is no one rule that everyone is waiting on, whether it's the vaccine or something else. It's exactly as Dr. Christensen described. It's trying to look at all of these measures, all of these factors that are interrelated to that balance of risk and benefit of children, being in school or doing remote learning.
All right, follow up to Dr. Christensen's data that he shared earlier. For the 17% of children in the ICU, Dr. Christensen, what are some of the common underlying health conditions you are seeing in them?
Yeah, a lot of them can be kids with congenital heart disease who are doing well at home, stable, and then the COVID hits and affects their breathing capacity, and because they don't have a lot of extra space there, that kind of knocks them over, and they need our help to get them through the infection. And the remdesivir has really been helpful in these really sick kids. So it'd be things like congenital heart disease or respiratory illnesses, such as cystic fibrosis, conditions like that. It can also impact kids with cancer who don't have a good immune system, although I think we're seeing less of that than the others.
We're getting a couple of questions. Dr. Christensen, how much remdesivir does Valley Children's have on hand? We're hearing some counties are out, and Bay Area hospitals are also reporting shortages.
Yeah, I mean, I don't know specifically. I do know that we get our share from the government, and that right now we have enough to get us through a short period of time. I understand that each patient takes a few full weeks worth of doses to get through. So I don't have a specific number on what we have, but I know we have an amount that just came in recently. We got our allotment. So I think we're okay for a little while. Obviously, you can never feel like you have enough of that.
A question from Elizabeth Aguilera. You mentioned that the rate of children, Dr. Christensen, testing positive is higher in this region than the state. Are you aware of any factors that could potentially be causing this? And do you have any type of racial or ethnic breakdown that you're seeing among our pediatric population?
Yeah, I think a lot of the spread of COVID is because people are forced to live in tight spaces, unfortunately. And the way COVID is defeated is by being outside more or having some room so that you can socially distance yourself from others, so that when you do cough or sneeze, either a mask is in place or you have space. I think in our area, unfortunately, the Central Valley, we have a lot of families that can't afford space and live in tight communities and housing that doesn't allow for that. So I think that's part of the reason why we have a rapid increase in cases, similar to, I think, what we saw in New York City to some extent. It's a big city and people who live tightly together there. And although, they were able to bring it down, we're just in the middle of bringing it going higher and higher. So we really need to control it by masking, social distancing. As far as the other question, we'll have to pull our data together. I suspect it mirrors the national and the California ethnic data, which is unfortunately it's impacting more of the Hispanic and people of color, but I don't have that data in front of me.
Okay, and I did just get an update that currently, this is in regards to the remdesivir, we have enough to currently treat 5 patients. So our supply is enough currently to help support the treatment of 5 COVID positive patients in our inpatient units. The next one is for Todd Centerpack. This is from Jocelyn Moran from CBS 47, and there are also a few others asking this question. This is about surge. How much of an increase are we seeing here? Are we in surge? And another question people are asking, how are we working with other area hospitals, Todd, to help handle that surge?
A great question. Great question. Yes, we are in surge mode. We have activated our emergency incident command structure earlier in the spring and continue to maintain that structure, which provides us with the most versatile and immediate response to any challenge that our organization may have, so that we can ensure that we have resources available to treat kids. We also have partnered in a different way with multiple hospitals in the Valley that are experiencing an overwhelming demand on their resources due to COVID-19. And as a result, they have closed their pediatric beds, transferred those patients to Valley Children's, and divert all pediatric patients to Valley Children's for care, so that they can utilize their previously designated pediatric beds for adult COVID patients. And as I said, there are multiple hospitals in the Valley, and we have additional conversations taking place, adding to our surge posture and the need for Valley Children's to surge. So I anticipate that will continue given the trends that we have seen over the last couple of weeks, and we'll be ready, and it's our privilege to take care of those kids.
Rookie move, I kept my microphone muted, sorry. We have a comment from somebody with KFCF Radio. They're saying the Wall Street Journal reporting lockdowns in the Southern Hemisphere reduced flu cases by half or more. Do you think that we should maybe institute some stricter measures here in the Central Valley? I don't know if you want to take that, Todd, or one of the docs.
I think that both Doctors Christensen and Mason have commented on the uniqueness of the challenges ahead of us. I think that it has been well established that masking and social distancing helps flatten the curve with COVID-19. And there is little, if any, scholarship to suggest that a similar impact could not be achieved. As far as I know, and I would look to the physicians on the call to validate, there's little to suggest that those practices would not assist in flattening the curve as it relates to seasonal influenza.
Yeah, I think that's accurate. I mean, it's spread very similarly, seasonal flu versus COVID. Most infectious diseases are spread through cough and sneezing, and there's few variations to that, but it's the same type of thing. You know, put the mask on and have some distance between you and wash your hands. I mean, that's probably the bigger key to everything, is washing hands, because that's how you spread it. And same with the flu.
Just to update you, in case those of you didn't see it in chat, there were a couple questions coming in about how many cases Valley Children's has treated of MIS-C. We are currently at 8. We have treated 8 children since this pandemic began, whose primary diagnosis was that multi-system inflammatory syndrome in children. Another question, not sure which one of you wants to answer this. What is your available bed capacity currently?
Sarah, can you restate that question?
What is our available bed capacity currently?
Staffed beds or licensed beds?
So licensed beds at the hospital, I've told the media before, we've got 330 here on the Madera campus, but I think it's probably more about staffed beds is what it sounds like, Todd.
Staffed beds, through our surge planning, we will be able to meet a census really as needed up to our physical space constraints.
Okay, if anyone has any other questions, you can hit the little, oh, we just got one coming in. Someone asked, do you know of a Valley Children's COVID positive case that has led to an outbreak at a child's home? Dr. Mason, maybe?
Yeah, I can probably address that. So no, I'm not familiar with that. So whenever we have a positive case of COVID-19, we report this to the health department right away. And then the health department, they are actually take on the responsibility of the contact tracing to understand whether there was an outbreak, a cluster, where did this case come from? Did the patient or the child get it from the family, household members, or somewhere else? And then the risk of transmission to others. So while we don't have this information immediately, I think our partners in the different health departments in the Valley will probably have more information about that. So basically, this is a question about contact tracing. And I have not heard of any case of a cluster where the child was the index case.
Okay, and then someone had a follow-up along that same line. Any cases came out of or led to a cluster at a daycare that you've heard about, Dr. Mason?
Also have not heard about any of that. Again, all of these are within the realm of possibility, but I just don't have the information. And again, I think these are questions that are answered by the health department.
Okay, all right. Before we end things, I want to turn it back over to Todd, who has a few final thoughts.
Thank you, Zara. My thoughts are very brief. I want to thank everyone for making the time to join us today. Remind you that we will provide these briefings with increased regularity as we go forward. Please do your best to remind everybody to social distance and wear a mask and stay safe. And again, we appreciate your time. Thank you very much.
Thank you to Todd Sunterpack, Dr. David Christensen, Dr. Niall Mason. And I do hope those of you in the media are able to share some information that we have. valleychildrens.org/COVID-19 is a website that we have created with all kinds of resources for families, including a list of testing centers throughout our region. So from Bakersfield up to Stanislaus County and then over to the coast, you can find low-cost, no-cost resources to get tested for COVID-19. We also have a hotline staffed by registered nurses here, the toll-free number on your screen, 888-286-9336. If you are local in the Fresno area, if you're in the 559, the number there is on your screen as well, 353-3333. If you would like this PowerPoint email to you, please shoot me an email or text me and I'll get that to you. Again, thank you everyone for joining us. Wear your mask, wash your hands. Have a good day.